Nationally, maternal mortality rates are down. A study published last month by the government's Office of Women's Health found a 57% decrease in maternal hospital deaths.
That's good news, but Georgia's maternal mortality rates are still among the worst in the country. Fox 5 News anchor Christine Spiro joins us tonight. And Christine, the state is now working to do things to prevent those deaths.
Yeah, Russ and Courtney, numbers from the state found 113 women died from pregnancy-related causes from 2018 to 2020. And officials estimate a large percentage of those deaths were preventable. This week, state officials highlighted efforts to treat hemorrhaging, high blood pressure, heart problems, and mental health disorders, which can all contribute to deaths. Another area of focus, working with hospitals to reduce the rate of preeclampsia and eclampsia by 20% by the end of the year. Both conditions are caused by high blood pressure. Experts say one of the biggest challenges for mothers in Georgia who have experienced preeclampsia is finding access to care.
Many of the conditions, and I work specifically in the area of preeclampsia, they come about literally within a day or two. The access to that care, the ability to go and drop everything, stop working, and go and get that care, that's a challenge.
Now, the state is starting a pilot program to visit new moms at home during pregnancy and for the first year after birth. The $1.7 million pilot program will focus on 5 rural counties in northeast Georgia and 16 in southeast Georgia. The State Department of Women, Children, and Nursing Services says half of that new department has already been staffed, and they plan to focus on women with high risk or chronic health problems. And it's amazing how the quality and access to health care and the policies in the state all contribute and are connected to maternal health. So it's so important, the policies, especially in the state.
Right. Combined with the fact that so many rural hospitals have closed in recent years.
Oh, yeah, that is a huge factor as well.
Good to know they realize that there's an issue and they're making an effort to address it.
But this is the first step. Yep.
All right. Christine, thanks.
Thanks.